Hi, classmates. How are you guys doing this evening? I hope you're doing a good day. I'm sorry about my voice. I'm coming down with a little sore throat. It's not coronavirus, I promise. It's just a sore throat. I always get sick around this time. And I'm sorry for my lighting, and I'm sorry for not looking the best. I had to do this on my bed because I don't have a recording camera, and I don't have like a stand to put my phone on. But this will do. Okay, so the the disorder I chose to do was phenylketonuria because it interests me because my brother he's disabled, but one of the disabilities he has is part of mental retardation, and this kind of ties into that. But we're not here to talk about that. We're here to talk about what this is and the symptoms and who it affects. Well, it affects everyone basically, but we're here to just give a breakdown of this gene. So it's also called PAH or PKU. Usually it's caused by an amino acid which will break down over time in the body, and it also really affects people who are diagnosed with this. It affects their metabolism, and it affects their brain, their mentality. A lot of times they can get anything from mental retardation to seizures to eczema to learning disabilities and behavioral problems. Like, those are just a few examples. Like, I can't name everything, but that's just some of them. And it's very, very important that patients are diagnosed early in life. So, newborns, they can't be diagnosed with it yet, but um, after a few months they can. But it's still very important because usually when they're diagnosed with it, they get some vitamins and nutrients, what you would expect. But they also have to go like on this protein diet where it's very very much a lack of protein. I couldn't put that here, but it's not a very good diet for adolescents and young people. It's just not a good diet that they don't have that much protein in their system. But nonetheless, that's what is used for it. And PKU is a recessive disease, and it brings out the PAH. So people who have this, like I said, they usually have anything from mental retardation to learning disabilities. So that's why it's very important that they are diagnosed very early in life. Like I said, there are some things that come along with it. It's different for every patient. Some patient will have very little side effects or symptoms, and some patients will have a lot. It just depends on the patient. A lot of times they have things like eczema, seizures, and shaking, and like I said, mental retardation. But they also have something that I found very interesting. It's like musty body odor, and it can vary from like their urine, their breath, just anything, and it gives them this terrible body odor, and they can't really help it. So a little history is that it was first kind of discovered back in 1934. This physician, she had noticed that these two Norwegian children had like a musty urine smell, and she went to like investigate, but of course they didn't really know what it was then. Back then, this uh, Nobel Peace Prizer, her name was her name was Pearl S. Buck, and her two daughters traveled to China. Well, later on, her daughter was diagnosed with mental retardation, and she ended up going to a special school, but of course they didn't know what it was. But then in the 60s they actually diagnosed her with PAK, and it was much too late by then. But regardless, that's what she was diagnosed with, and she never really had a normal life after that. Her mother wrote a book about her called The Child Who Never Grew, and she said about her daughter in one part of the book, she put, I remember when she was 3 months old, that she lay in her little basket upon the sun deck of a ship. I had taken her there for the morning air as we traveled. The people who promenaded upon the deck stopped often to look at her. My pride grew as they spoke of her unusual beauty and the intelligence of her deep blue eyes. Very beautiful. I really like that. As someone who, knows people with disabilities, that I really like that quote. So there's been over about 500 mutations connected to this disorder. The most prominent is in macaro, and there's not much in North African countries, but at the same time they haven't really like tested over there. But there is about 8,000 babies in Western Europe who, excuse me, are born with this gene. But again, French, Canada, mackerel, and Italy are like, big countries where it's found. I said earlier, patients are usually diagnosed with some type of mental disability. And usually they have to always take blood tests because their blood is actually very important. It determines, how far, well, not how far, what am I saying? It determines how healthy or how poor their health is. And of course, we want them to have the best health as possible. So that's why it's important they take blood tests every appointment they have. And also, again, the diet and the vitamins will also help, but again, the diet doesn't really help that much. So there is no cure at the moment. We don't have a cure, but we do have treatments. It's kind of like, like HIV. There's no cure, but there's treatments where you can live a long, normal, healthy life. It's the same with this. Like I said, protein-free diets, um, vitamins, minerals. Even, pregnant women have to follow this diet. And again, the diet is not that good, but for their own health and safety, so they don't really have any brain deficiencies, they have to follow this diet. So inheritance risk, it is inherited. I already said that before. I think you can inherit it from parents. Your parents' genes do definitely affect your genes. So like, if one of your parents has blue eyes and your other parent has brown eyes, you are most likely going to have brown eyes as the dominant gene, or you could have like a mix, like a hazel color, but most likely your eyes are going to be brown. But in this case, the child, if one of the parents has PKU, the child will have a altered genes, which means their genes won't be that of a normal child. But that doesn't always mean they'll get the disease as well. They just have altered genes from because one of their parents. So this gene is found in other species, and I had no idea. It's found in anise. I'm sorry. It's like a donkey, basically. It's a donkey that that this is also found. A gibbon, chimpanzee, bonobo, gorilla, humans, and a California sea lion, and a bats, which I know because of the outbreak, we're all not all fan of bats right now. But yeah, so basically that's just telling me that all of these species can have these mental issues, which I guess shouldn't be that big of a surprise. Of course, the animals who have a higher chance of getting it are, bonobos, chimpanzees, gorillas, because they are our closest relatives. But I had no idea that, humans and like lions and like, donkeys and rats, they all have a common ancestor. And I'll put the name of every species in a paper below if you want to read about it, because that really fascinated me. I'm like, what? Like, we have a common ancestor with undersea life? That's crazy. So yeah, that is all for my presentation. I'm very sorry. I feel like I could have made it, longer, better explained, but I mean, because it's not that I don't know how to word this. It's not like It's not a huge disease that a lot of people know about, so I couldn't really find a lot of good information out there, but I think the information I have is pretty good. So that's all, folks, in my Looney Tune voice. That's all, and I hope you liked my video, and yeah, have a great day, and be safe, wash your hands.